thank you to the Association of Migraine Disorders. This is such an important topic, and I'm really, really glad to be able to talk to you about it here today. This is an exciting time as you're thinking about pregnancy, but when you live with migraine, the concept of not being able to take medications that you want to take can be a really daunting one. So I'd love to kind of walk you through some potential options that you can consider bringing up with your headache specialist and obstetrician. So I'll first kind of go over a little bit about migraine and pregnancy and what to expect, and then we'll kind of talk about how to plan for a pregnancy when you live with migraine. Thank you. So in terms of pregnancy's influence on migraine, there's a lot of good news here, and that is that up to 80% of women can experience an improvement in their migraine during pregnancy. This is often for women with migraine without aura, and we tend to see this improvement more towards the second and third trimester, which still means that the first trimester can be a very difficult time, especially in conjunction with morning sickness. And so it's important to be aware of some strategies to help you manage migraine, because you may be likely to experience attacks during the course of pregnancy. It's also important to note that for women with migraine, there is a slightly increased risk for some pregnancy outcomes like preeclampsia. So make sure that your obstetrician is aware of this so that they can monitor you closely for any adverse outcomes that may be coming up. And then one thing that I think is really helpful is I like to see my patients months in advance of them trying to get pregnant. And sometimes that's not always possible. About 50% of pregnancies are unplanned. And so when you are speaking with your headache specialist about different medications, make sure if you are a person of childbearing age, a woman of childbearing age, that you know the safety of medications during pregnancy in case you do get pregnant. But if you are thinking about a pregnancy, it's great to talk with your neurologist ahead of time and to talk about a few different things in particular. One of those is really optimizing the behavioral strategies for helping you to manage migraine. And this is really turning to non-medication strategies that can be very helpful, that have been proven efficacious in managing migraine. You want to also review your current medication strategies and decide which ones are appropriate to continue and which ones need to be discontinued before you're pregnant. And you want to develop a migraine action plan. You want to be solid in what are you going to do when you have a bad headache. And I loved what Alicia said of like, what's my step one? What's my step two if things don't work? And I think it'll provide you with some reassurance if you have a plan in place there. So the next slide, just kind of I'll give you kind of a brief overview of elements of a successful migraine treatment strategy. And there are three main elements, which include behavioral strategies such as maintaining a regular schedule, mindfulness and meditation, some rescue strategies. Some traditional rescue strategies are medications like non-steroidal anti-inflammatory drugs, triptans, acetaminophen, some newer medications to the market such as Gepants and Dietans. These are medications that you take in the moment when you're having a bad headache. And then there are preventive strategies, which can include some vitamins and minerals. It can include some medications that we often borrow from other fields, such as antidepressants or anti-blood pressure or anti-seizure medications, along with some newer medications to the market, like onabotulinum toxin A, and these medications called CGRP monoclonal antibodies. The point is that there's a lot out there that we can access. But moving on to the next slide, I want to kind of highlight some of the things that we want to be mindful of as you're kind of thinking about a pregnancy. So in the next slide, we'll kind of look at the different, for behavioral strategies, there might be some modifications that you make to the different strategies that you utilize, perhaps during a pregnancy, speaking with your obstetrician about what are exercises that are safe for you to be doing. With rescue medications, you may think about trying some different ones, and we'll kind of go over some options that you might consider. And there also might be some medications to avoid as you're trying to get pregnant that might interfere with that process. And when it comes to preventive medication, you really have to understand which ones are going to be safer in pregnancy, and those that aren't safe in pregnancy, you may have to stop those in advance. In terms of behavioral strategies, just to kind of go over there are some kind of lifestyle strategies that can be helpful. Maintaining a regular schedule can be really beneficial. And migraine attacks tend to be triggered by changes to routine, to schedule, hormonal fluctuations. Some of that is within our control and some of it isn't. But to the extent that you are able to exercise on a regular basis, eat regular meals, get restful sleep, have healthy meals and stay hydrated, those things can be helpful in making you less prone to having a migraine attack. There are also mind-body strategies such as biofeedback, relaxation, and cognitive behavioral therapy. These things take time to learn and to enact. And so it's great if you have time before pregnancy to be able to learn these techniques well, so you can utilize them even during a pregnancy when you have a migraine attack. And they are well-proven, efficacious strategies that don't have adverse effects for baby. There's also body-based practices, things like acupuncture, although you do need to let the acupuncturist know if you are trying to get pregnant or are pregnant, because there are some sites that can induce labor, as well as physical therapy and yoga, which can be helpful. When it comes to medications, this is an important opportunity to sit down with your headache specialist and your obstetrician and talk about what's the safety of the medications that you're on from a pregnancy perspective. And some medications you will want to consider discontinuing prior to pregnancy for the safety of baby over the course of pregnancy. So in the next slide, we'll kind of focus on rescue strategies first. So in terms of rescue, sorry, you can advance the next slide. So in terms of rescue strategies, one thing that can be really daunting is the idea that you can't take rescue medications as you're trying to get pregnant, because we don't know how long that's going to take. And so this strategy that I'm going to highlight here might allow you a little bit more flexibility. And the strategy involves kind of separating out your cycles. So if you have a regular menstrual cycle, during the first half of the cycle, between when you have your period or you menstruate and ovulation, at that point you shouldn't be pregnant. So you can take most of the rescue medications that you want to be taking. For the second half of the cycle, between ovulation and menstruation, there is a chance that you could get pregnant. And so that might be a time to be more restrictive about the rescue medications you're taking. And hopefully this gives you more flexibility within your menstrual cycle to be able to have medications you can take so you don't feel that you have nothing. And moving on to the next slide, we'll kind of highlight some of the medications that you can that you might want to think about avoiding when it comes to rescue medications. So for opiates and butalbital containing products, these aren't really recommended for frequent headache treatment. And part of the rationale for that is that they can readily cause rebound headaches or medication overuse headache. They also have addiction and abuse potential, so we worry about their frequent use. There are some medications, such as a class of medications called GPANs, lasmiditan, and dihydroergotamine, that are not thought to be safe in pregnancy. GPANs in particular are a medication that block CGRP, the receptor to CGRP. And CGRP has roles in fetal development, and abnormal levels can actually increase the risk for preeclampsia. So for that reason, I have theoretical concerns with being on medications like ubrogepant, rimegepant, and atogepant as you're trying to get pregnant. Also, with nonsteroidal anti-inflammatory drugs, some of these can interfere with embryo implantation. So just be extra cautious. I believe ibuprofen doesn't, but some of the other ones can. So if you're trying to get pregnant, this would be a class of medications to be a little bit more careful about. And then one thing that I find really helpful is to kind of develop a migraine rescue action plan with your obstetrician and your headache specialist and enact it before you get pregnant so you can see if you're comfortable with it and if it works well for you. For me, the first line would be behavioral strategies. What are some non-medicine techniques and tools that you can be using to help with managing the pain? Sometimes that won't be enough and you may need medication. So the second line would be medications such as acetaminophen, metoclopramide, and diphenhydramine. These are thought to be relatively safe in pregnancy. Occipital nerve blocks, which I'll go over in a moment, and neuromodulation devices are really interesting techniques to be able to use both preconception and during pregnancy. When it comes to non-steroidal anti-inflammatory drugs or NSAIDs, again, you want to be careful preconception because it can interfere with embryo implantation. And during pregnancy, there's only a small window of time when it's really okay to be using NSAIDs. So you should definitely talk to your obstetrician about when it is safe. And third line, you might think about our traditional triptans, which we use as a migraine rescue often. And that could be a third line option when you're pregnant, ondansetron and promethazine as well. And I know that next week you'll be hearing about migraine in pregnancy, so it'll be really interesting to get their take as well. When it comes to nerve blocks, these are a great option if it is available to you. What it is it's an injection of anesthetic, typically lidocaine, because that's thought to be safer in pregnancy. It's done at the back of the head. It burns as it goes in, and then it causes a sense of numbness that persists for a few hours, but that can give pain reduction or relief for a number of hours to days. While it's not very, very well studied in pregnancy, this is thought to be a relatively safe option and can be a great option if you're having a bad migraine flare-up and you don't want to take oral medications because it is a local treatment, so unlikely to affect baby. And this is something that I utilize for a lot of my patients who are pregnant if they're interested in trying something to break up a cycle of migraine, but they're afraid about taking medication. And the next slide kind of highlights some of the really interesting neuromodulation devices that are out there. These are tools that could be considered during pregnancy. They're non-invasive, they're not medication. They have been cleared by the FDA for use as migraine rescue or preventive options. To be clear, they have not been studied in pregnancy, but when we think about the mechanism of action of these devices, I'm hard pressed to imagine how it would impact baby directly. These are stimulation devices that stimulate nerves or magnetic stimulation devices. And so these are really reasonable options to think about. The problem with them is oftentimes that they're not covered by insurance. So there is a cost consideration here, but if it is affordable to you, you may want to consider trying this preconception to see if it's something that can work well for you and that you feel comfortable using during a pregnancy. Now I want to shift focus to talk a little bit more about preventive options. So for those individuals who have frequent migraine, you may be on a preventive medication. And some of them are not safe in pregnancy. And so you need to think about how long in advance do I need to stop this medication in order for it to be out of my system as you try to get pregnant. And you should also talk with your headache specialist about whether or not you should replace that with a different medication if your headaches are very frequent. When it comes to oral medications, these usually have a pretty short half-life, which means that they're cleared out of your system over the course of a few days. So once you stop it, a few days later, it should be out of your system. Medications like topiramate, valproic acid, candesartan, lisinopril, and venlafaxine are sometimes used for migraine prevention, topiramate in particular. And because these are not safe in pregnancy, I would strongly recommend tapering off of these medications in order to prepare you for a safe pregnancy. When it comes to injectable medications, such as irenumabe, fremanezumab, galcanezumab, as well as onabotulinum toxin A, these ones have a very long half-life, so they do require months of no use in order to clear them out of your system. I would strongly recommend avoiding irenumabe, fremanezumab, and galcanezumab during pregnancy. I would stop it a number of months in advance of even trying to get pregnant. With onabotulinum toxin, this one is a little bit more controversial, and you should work with your headache specialist and obstetrician to determine if this is something that everybody feels comfortable continuing. There are some headache specialists that recommend strongly against it, and others would counsel you about the potential for risk, but there's really not a lot of robust safety data out there, such that many people don't feel comfortable continuing onabotulinum toxin A into pregnancy. But the next slide, which is that there are preventive medications for migraine out there that are relatively safe in pregnancy. And so the question to your headache specialist would be, do I need to be on a preventive since migraine might get better during pregnancy? And if so, which one would be more favorable compared with some of the other medications that I just spoke about? So some of those options might include medications like cyproheptadine, verapamil, memantine, some of the nutraceuticals like coenzyme Q10 and riboflavin, along with non-invasive neuromodulation devices, which I spoke about a bit earlier. Just a quick reminder that as you're going through any journey to try to conceive, if your headaches change in any way, you have a change in pattern, you develop new neurologic signs or symptoms such as visual changes, weakness, numbness or tingling, or changes to speech or swallowing, or you develop an unusually severe headache, it's really important to alert your doctor so that they can evaluate for the possibility of another kind of headache rather than migraine. So in summary, just a quick reminder that migraines, again, can improve during pregnancy, which is great news, but not unfortunately for everybody. So it's important that you have a plan in place. Try to talk to your doctor about pregnancy-safe medications and about your current migraine treatment strategy and whether or not that's appropriate in pregnancy. Consider discontinuing those medications that are not safe during pregnancy, and develop a migraine action plan that hopefully you can try out before you get pregnant so you can see if it works well for you. Thank you so much for the opportunity to speak here today.